If you have recently had a knee surgery, you probably notice stiffness, weakness, difficulty in moving your knee comfortably. One of the most important parts of recovery is starting safe, controlled exercises that helps to restore strength, mobility, and confidence in movement. In this video, I will guide you through 3 simple physiotherapy exercises often used in early knee rehabilitation: quad sits, heel slides, controlled sit-to-stand movements. Let's take a look. Hello everyone, I'm Radha Durai Babu, registered physical therapist at Vertex Physiotherapy. Exercise 1, quad sits. The first exercise is called quad sits, and it focuses on activating your quadriceps muscle, which plays a key role in supporting the knee joint. Here is how you perform it. Sit or lie down with your leg extended straight. Tighten the muscles in front of your thigh. Gently press the back of your knee towards the surface beneath you. Hold the contraction for 5 seconds. Relax slowly. Repeat this 10 times, aiming for 2 to 3 sets per session. This exercise helps to wake up the quadriceps muscle after surgery and improve the knee stability during movement. Exercise 2, heel slides. The second exercise helps improve the knee bending mobility. To perform a heel slide, lie on your back with both the legs extended. Slowly slide your heel towards your body, bending the knee. Move only within the comfortable range without forcing the movement. Pause briefly and then slide the heel back to the starting position. Perform 10 to 15 repetitions. Heel slides help restore knee flexion, which is important for daily activities such as sitting, walking, and climbing stairs. Exercise 3, controlled sit to stand. The third exercise focuses on functional strength, which helps with everyday movement. To perform a controlled sit to stand, sit at the edge of a sturdy chair. Keep your feet flat and shoulders width apart. Lean slightly forward. Slowly stand up using both legs. Then slowly lower yourself back down with control. Start with 8 to 10 repetitions. This exercise strengthens the quadriceps, hips, and supporting muscles, helping improve the stability when getting up from chair or climbing stairs. Key recovery tip: during post-surgery knee rehabilitation, it is important to focus on controlled movement, consistent practice, and gradual progression. Avoid rushing the exercises. Proper technique and steady repetition help restore strength, mobility, and confidence in your knee joint over time. If you are recovering from knee surgery, knee stiffness, and mobility limitation, physiotherapy can guide you through the right exercises to safely restore your movement. If you find this video helpful, like the video, share it with someone recovering from knee surgery, and follow for more physiotherapy exercises and tips from Vertex Physiotherapy.
When should knee rehabilitation exercises begin after surgery?
Most knee rehabilitation program begins early after surgery, depending upon the procedure and the surgeon's recommendations. Early controlled movement helps reduce stiffness and encourages muscle activation.
How often should these exercises be done?
Early rehabilitation exercises are often performed 2 to 3 times per day in small sets. Consistency helps to improve the strength, mobility gradually.
Why do the thigh muscles feel weak after knee surgery?
After surgery, the quadriceps muscle temporarily loses the activation due to swelling, joint trauma. Exercises like quad sits helps to restore normal muscle function.
Is mild swelling normal during recovery?
Yes, mild swelling can occur as the knee heals. Managing activity levels, elevating the leg, and following physiotherapy guidance helps keep the swelling under control.
How long does it take to regain normal knee strength?
Recovery timeline vary depending on the type of surgery, rehabilitation program, and exercise consistency. Progressive strength training and mobility training support a steady return to daily activities.